Hi, I'm Eric Schaefer. I'm in BSN 225, Section 11. Today we're going to be demonstrating the administration of an intramuscular injection. We have an order for our patient, Mr. Smith, to give an intramuscular injection. The order states we're giving morphine at 6 milligrams IM. So we've received our order. We're going to go ahead and pull up our MAR, and we want to verify our order. So we're going to be looking at our order, making sure that we have the right patient, the right medication, the right route, dose, and time. And then we're going to verify our 6 rights. So again, we're checking right medication. I'm sorry, right patient, right medication, right dose, right route, right time, and then that we have the right documentation. So after we verified our 6 rights and we verified our MAR, we're going to go ahead and grab our supplies. So our supplies today, we're going to grab our medication. So our medication ordered is morphine. This is a narcotic pain medication. Our vial provided is 4 milligrams per ml. So our order states to give Mr. Smith a dose of 6 milligrams. So for today, we're going to be drawing up 1.5 mLs. We're going to grab the appropriate syringe. So we've grabbed a 3 milliliter syringe. We're going to grab a blunt needle for drawing up our medication. We're going to grab a appropriately sized hypodermic needle. For this patient today, we grabbed a 25 gauge, 1-inch hypodermic needle. For IM injections, your needle gauge should be between 22 and 25 gauge, and it should be 1 inch to 1.5 inches long. It's going to be depending on the size of the patient, the site of injection, and then the viscosity of the medication. So for this patient today, we've selected the appropriately sized needle, which is going to be a 25 gauge, 1-inch hypodermic needle. We have alcohol swabs for cleaning the tops of our vial and for disinfecting the site of injection. We have gauze to apply after giving the injection. We have hand sanitizer for hand hygiene. And we have gloves for when we're drawing up our medication, for when we're giving our medication. So after we've gathered all of our supplies, we're going to go ahead and take them, and we're going to go ahead and go on over to our patient room. So we're going to knock on the door. Mr. Smith, I'm Eric. I'm your nurse. Your doctor has informed us that you're in some pain and has ordered some pain medication for you. Is it okay if I come in? Patient has given us permission to come in, so we're going to go ahead and enter the room. We're going to go ahead and close the door behind us for privacy. After we've entered the room, we want to verify our patient. So we want to ask our patient, Mr. Smith, can you go ahead and state your full name for me? And then can you state your date of birth? And we're going to look at the armband and we're going to verify this as he's telling us. After we verified our patient, we want to ask our patient if he has any allergies. So Mr. Smith, do you have any allergies to medications, food, seasonal, any other allergies that I should know about? Patient states that he doesn't have any allergies, so we are okay to proceed. So at this time, we're going to explain to our patient what we are there for and provide some education on the medication that we're going to be giving. So Mr. Smith, your doctor has informed us that you're in a little bit of pain. At this time, I would also assess my patient's pain level. I would ask him what his pain is currently at on a scale of 0 to 10, 10 being the worst, and the location of the pain. Once he has informed me, then I would go ahead and document this. That way we would have a baseline of what to go off of to see if there's been improvement after giving the pain medication. We would also, again, inform Mr. Smith, this is a narcotic pain medication. This should help with your pain. When I give the injection, you may feel a slight burning or stinging sensation. This is normal. This should go away shortly. As well, this medication does have some side effects. So side effects of this medication are going to be a little bit of tiredness, drowsiness, may cause a little bit of itching of the skin, can cause burning and stinging at the injection site, could be a little bit of redness at the injection site, some bruising after the injection. These are all normal. If you experience these should go away shortly. This medication also has some adverse effects. So if you experience any of these, it is very important for you to tell us immediately. So let myself know, let the doctor know. If you're at home, call 911 or go to your nearest ER. Adverse effects of this medication are going to be severe lethargy, confusion, drowsiness. It will cause or can cause shortness of breath and difficulty breathing. It can also cause signs of allergic reaction, anaphylaxis. So severe itching, swelling of the hands and face, and again, shortness of breath, difficulty breathing. If you experience any of these, please let us know. I would then ask Mr. Smith if he has any questions. He does not have any questions, so we're going to go ahead and proceed. So at this time, I'm going to go ahead and prepare to drop my medication. Before doing so, I want to apply hand hygiene. So I'm going to use a hand sanitizer on my hands. I'm going to apply clean gloves. And I'll get ready to drop my medication. So prior to drawing up my medication, I want to go into my MAR. I want to verify my order one more time. Mr. Smith is getting an IM injection of morphine. He's getting it at a dose of 6 milligrams. So our dose is, our vial is dosed at 4 milligrams per ml. So we're drawing up 1.5 mLs. I want to look at my label, verify my label. I want to also check my expiration date. At this time, I'm going to go ahead and clean the top of the vial. So I'm going to use an alcohol wipe to clean the top of the vial. I'm going to scrub the top of the vial. And then I'm going to go ahead and set that off to the side to dry. So I've got my supplies. I've got my 3 ml syringe. I'm going to go ahead and remove that from the packaging. I've got my blunt needle that I'm going to go ahead and remove from the packaging and then attach that to my syringe. Then I'm going to, leaving the cap on, I'm going to draw up my desired dose, which is 1.5 mLs of air. So I'm going to pull the plunger back to the 1.5 mark. I'm going to then remove the cap and I'm going to insert that into my vial. And I'm going to expel the 1.5 mLs of air into the vial. I'm going to then invert the vial, keeping the tip of the needle below the level of my medication. I'm going to pull back on the plunger until I'm at my desired dose of 1.5 mLs. I want to visually inspect my syringe and see if there's any air bubbles. If there is, I want to flick those to the top and then reposition my plunger to the 1.5 ml mark. I will then remove the needle from my vial. I will use the one-handed swoop technique to recap my blunt needle like this. And then I will replace the blunt needle with my 25 gauge 1-inch hypodermic needle. So I will remove the blunt needle and I will dispose of that in the sharps container. And then I will connect my 25 gauge 1-inch needle. And I'm going to verify that my medication is at the correct dose of 6 milligrams. It is a 1.5 ml dose of morphine. And I'm going to verify that one more time with the MAR before giving that to my patient. If I was at the nursing station, I would label my syringe. Prior to taking it to the room, I'm going to label it with the patient's name, the drug, the dose, the time that it was drawn, and I would initial that I was the RN drawing up that medication. We're at the bedside, so we don't need to worry about labeling it. So we're going to go ahead and determine the appropriate site for giving the intramuscular injection. So we're going to take a look at the right hip. So I'm going to have Mr. Smith just roll over onto his left side, and we're going to assess the right hip. I'm going to ask Mr. Smith if we can just raise his gown so I can assess the area. I want to palpate the area. I want to notice any masses, any tenderness. I'm looking for bruising, edema, abrasions, lesions, any bleeding, anything that I notice. If it's present, any abnormalities, then I'm going to go ahead and select a different site. This site does not have any abnormalities present, so it is okay to use. We're going to anatomically determine the area that we're giving the injection. So to do this, we want to palpate. We want to find the greater trochanter of the hip. Once we've done so, we want to position the palm of our hip on the greater trochanter, and we want to position our thumb towards the groin area. We want to position our pointer finger towards the superior anterior iliac spine, and then we want to position our middle finger towards the buttocks. This is going to form a V shape, and in between that V shape is where we're going to be giving our injection. While doing this, I'm going to just mark our injection site with an alcohol wipe so I know where our injection site is. And then we're going to go ahead and clean the area. So to do this, we're going to use alcohol. We want to clean the injection site from the inside and working our way out in a circular motion. After cleaning the site, we're going to allow that to dry. We're not going to touch that. And then we're going to grab our medication. We want to apply pressure with our non-dominant hand using the ulnar side of our non-dominant hand. We want to apply traction of approximately 1 to 1.5 inches laterally. We're going to remove the cap of our needle. Again, applying traction to the injection site. We're going to hold the needle bevel up, palm down with our thumb and our pointer finger. We're going to inject the medication at a 90-degree angle. Again, pulling that traction, we're going to inject quickly. Once we're in, we want to use the thumb and pointer finger of our non-dominant hand to stabilize the needle. We want to aspirate. If we do not get any blood to draw back, then we are in the right location and we can go ahead and proceed. If blood comes back, then we are in the wrong location and we need to start over. Once we've determined we are in the right location, we're going to slowly administer the medication over 10 seconds. After giving the medication, we want to hold the needle in place for another 10 seconds. And then we want to slowly and steadily remove the needle and release traction of the skin. We will immediately dispose of the needle into the sharps container, and we will dab away any blood left over after the injection. We will not massage the area. We will then ask the patient if he has any concerns or questions. If he does not, we will ask him if he needs any help with repositioning or getting into position of comfort. We will place his call light within reach and let him know to notify us if he experiences any adverse reactions. We will go ahead and remove our gloves. We will apply hand hygiene. We will grab the medication vial and we will take that with us. We will excuse ourselves from the room. We will close the door behind us to allow for privacy, and we will document our procedure.